A picture painted in a report by the Agriculture Minister shows the fight against foot and mouth disease is far from over. This is informed by the limited number of the animals the government can ensure that they are vaccinated. Members of Parliament were told by the Agriculture Minister Frank Tumwebaze that the government is only able to buy 500,000 doses of the vaccines.
Government of Uganda, through the Ministry of Agriculture, Animal Industry and Fisheries, has been providing a budget item for procuring vaccines. This, however, has been insufficient and only covers 1.1% of the susceptible domestic animal population, contrary to the recommended of at least 80% coverage, leaving the rest of the herd vulnerable.
However, 88 million doses are required to cater for the susceptible animals, whose number is estimated to stand at 44 million, taking care of cattle, sheep, goats and pigs.
This, however, has been insufficient and only covers 1.1% of the susceptible domestic animal population, contrary to the recommended of at least 80% coverage, leaving the rest of the herd vulnerable. This explains why the country experiences repeated outbreaks.
Each dose of the vaccine reportedly costs about 7,000 shillings, meaning about 670 billion shillings would be required annually.
Government has been studying this financial implication and notes the financial stress it would impose on the national budget if the requirement of the biannual mass vaccination is to be achieved.
Tumwebaze says the inadequate budget allocated for the vaccines is the reason the government opts for ring vaccination to target the animals at high risk. The other method is quarantine, aimed at disruption of transmission of the disease, although the method in some cases has proved ineffective.
District officials and stakeholders, some break quarantine deliberately, and we have some districts. I have not mentioned them for now, but we will mention them if need arises.
So far, a total of 36 districts have been put under quarantine, while the neighboring areas are on surveillance. Other measures for eradication of the disease suggested are biannual compulsory vaccination exercise of the entire susceptible animal herd, or test and slaughter, followed by safe disposal of the carcasses either by burning or burying. Both measures are unaffordable for the government.
Destruction of affected animals under the test and slaughter approach, the country cannot afford to implement this provision of the law due to high compensation budget requirements.
Cabinet will next week consider a number of policy options, which include cost sharing, according to Tumwebaze. Tumwebaze told members of Parliament that the ministry has in the meantime repurposed its development budget to provide for 2.56 million doses, ordered for another 2.3 million doses, which will arrive in a few months, since they have to be ordered from the manufacturer. When the vaccines become available, it is planned that vaccination could be made compulsory for every eligible animal, and their movement will require proof of vaccination. Jackson Onyango, NTV.